So I have patients who ask me, Dr. Bone, you have a nice private practice, but I also know that I could go down the street and get my card through a clinic. Is there a reason that I shouldn't do that? And my feeling is that there is benefit to having a professional to guide you through the experience. Now, if you're somebody who has a lot of experience and you don't feel that you want professional guidance, I might not be the right doctor for you. But a lot of my patients are people who either had a bad experience once before, but they still want to try, or they've never used, or they have complex medical problems and they want someone who will sit with them, go through what they take as regular medications, what experiences they've had with other practitioners, and help them to get a treatment plan that incorporates the cannabinoids, but not just, here's your card, you can go to a dispensary and purchase and start trying and seeing what's good for you. So part of what I think my value is that I like to sit with patients, hear their story, and really try to figure out what's the best use of cannabinoids to solve their particular problem. So in a practice where we treat men, women, and children, what kinds of things do we use medical cannabis to treat? It's a great question. So we can start first of all with children, right? We treat children for epilepsy. We do treat children for autism spectrum disorders, and we do that in conjunction with another medical cannabis provider. So all pediatric patients need to have 2 different practitioners qualify them. So I work in conjunction with other cannabis doctors to do that. As far as men, the most common reason why my male patients will come in and see me, chronic pain related to arthritis, sports injuries, herniated discs, degenerative changes in the back, very, very common. And that would be head and shoulders above everything else we treat men for, although I would tell you that anxiety and insomnia are fairly common in men as well. Women, it's a very mixed bag. We have a lot of women patients who come in with chronic pain, but because of my experience as a gynecologist, I'll treat people for endometriosis, pelvic pain, mood disorders associated with menopause, perimenopause, premenstrual syndrome, and then of course anxiety, depression, insomnia, fibromyalgia, chronic pain. Those are all things that we treat very commonly here. Unfortunately, those are not things that you treat once and then they go away. They're ongoing disorders like high blood pressure or sugar diabetes. You wouldn't say to somebody, all right, take this medicine for diabetes for a week and your diabetes is going to go away. But we manage diabetes, we manage high blood pressure with a lot of long-term medications. And I see cannabis for a lot of ailments to be quite similar. They're ongoing treatments that help patients to maintain while they're experiencing all those symptoms. There may be periods of time when anxiety is less prominent and they can decrease or even stop transiently what they're doing. But most people will end up starting back again when the issues re-arise. So, for insomnia, a lot of patients, if we can get them into better sleep habits using cannabinoids, I have seen patients use them and then put them aside and their sleep stays in a pretty good pattern for a while, but then sometimes they need to go back and reuse again. For chronic pain, I would say most patients will continue to use on a regular basis, just like they would take Advil or Mobic or Celebrex or even narcotic pain medications. And of course, cannabis offers a great alternative to opioids and helps very much in trying to get patients off opioids. Same goes for anxiety. Patients with a lot of anxiety, PTSD, who are on a lot of antidepressants and drugs like Xanax or Klonopin, which we call benzodiazepines, those patients, we can get them either down to very low dosage, sometimes completely off, by using certain types of cannabinoid medicines, and they work wonderfully. Cannabis per se is not really an addictive drug, but there are people who could get addicted to anything. They get addicted to eating or drinking, and so addictive personalities can in fact become addicted to cannabis by overusing. But unlike other drugs that you would become addicted to, like Percocet or Vicodin, where taking it away suddenly causes withdrawal, which can in fact sometimes be life-threatening. There's no such thing as life-threatening withdrawal from cannabis. Patients get grouchy for a day or two. They may not feel great, but nothing bad ever happened to them. So when I have parents who bring in a child that needs cannabis for treatment of a disorder, I tell them the key is to use as low a dose as you can get away with. Start low, slowly increase to get to your desired effect, and don't be afraid to say no if you feel like it's starting to go higher than what you want and getting out of hand. Because something called a tolerance break, where we take patients off for 3 to 5 days and let them start again, can be very beneficial. It's like resetting the receptors, and then we can get away with less product moving forward. I have yet to have any patients that I have in my practice where I'm concerned that they're truly an addict to marijuana. When I see a patient is what we call creeping up in their THC usage, THC being the psychotropic portion of marijuana, I visit with the patient and I discuss the situation and either recommend a tolerance break or look at how they're getting their marijuana, the delivery system, and see if there are things we can do to maximize the benefit without increasing the dosage as the approach. Because after a while, tolerance does develop and people tend to need a little bit more. But tolerance alone should not let you say to a patient, well, just keep going and going and going. There are certain conditions where we try not to limit. Terminally ill patients, for example, who are using marijuana for tremendous pain, and those type of patients, we don't worry as much about addiction or high dosages. But for most patients, I find, and this is shocking to many people, you don't need a lot to get the job done. And there are outliers. There are certainly people who need a lot, but for most patients, a little bit does a great job. Sure. So why are people afraid of marijuana? I mean, if you go all the way back to 1930s when the movie Reefer Madness came out, you should watch that movie on Netflix, by the way, anybody who's seeing this video. So it shows people taking hits off marijuana or smoking incessantly, it sort of shows. And one woman runs out a window and somebody else hits somebody else over the head and they claim you're gonna rape somebody if you're doing marijuana. Okay, none of that is the case. However, but in fact, movies like Reefer Madness inform how people feel about cannabis today. There seems to be a big difference between kids who have grown up with cannabis now and their parents. So their parents are deathly afraid that cannabis is a dangerous drug. They feel it's a gateway drug. I do not believe cannabis is a gateway drug. Can you get out of hand with cannabis? Of course you can, but thank goodness no one has ever died merely of a cannabis overdose. If you take too much cannabis, there are things you can do to help mitigate some of the things that happen to you, but even if you don't, you may feel very paranoid and uncomfortable, but it will go away on its own. The thing about it is when you first start using cannabis, the sensation of high is experienced differently by different people. There are those who say it's euphoria. I feel wonderful. But then there are some people who it goes past euphoria into anxiety and paranoia and fear. And that can be a very bad place to be. And my goal as a cannabis practitioner is to prevent people from getting there. And the way we do that is we say slowly increase. If you take too much too fast and you have a paranoid reaction, you're not going to want to use anymore. And you're not going to have faith that the medication can do what you want it to do. So in those who find euphoria, they will have a positive reinforcement to keep using. In those that have had a bad reaction, it can be hard to even get them to try again. And I very commonly see people come in and I say, what is your experience with marijuana? I ask every patient. And they say, I did it once in college, but I got really, really paranoid and I never did it again. And I know, well, that patient had too much THC for what's good for them. And we need to work around that and start higher in the non-psychoactive cannabinoids and only add the amount of THC, which is psychoactive, that we need to get the job done. For everybody. I do have patients who come in that are on, for instance, narcotics for pain. They're made to feel very guilty at the pharmacy, by their doctors, by their family, by their friends that they use narcotics. And they try cannabis and they really do, but they don't get the relief that they get from the narcotics. And one of the things that I think is important in cannabis medicine is to understand that it's good for a lot of people, but not for everyone. So some of those patients, we come to the conclusion together that it's not doing what they want it to do, and maybe they're better off following their traditional allopathic medical treatment for their pain. The other thing I can tell you is there are patients who have a history of psychosis or schizophrenia, and psychosis meaning there are moments when they have breaks with reality or they have hallucinations. These patients are not patients that I would want to put on cannabis. One of the big contraindications to cannabis are in younger adults, from even teenagers, from maybe 15 to the 20s, who have any history of schizophrenia or psychotic episodes, because you can induce them to come back out again, and it's almost like you can train the brain to go in the wrong direction. And so I'm very leery to use cannabis in people with a lot of psychiatric issues at a young age. Having said that, there are people who come in here who ask me, could you help me use cannabis to treat my cancer? It's a very common request for a consultation. While I do believe that cannabis holds great promise to treat cancer, we're not there yet. We're doing studies. Harvard just came out with a preliminary study on canaflavins and pancreatic cancer, for example, just last week. But it's not ready for prime time. You can't come here and say, I want a protocol to treat my cancer. So that's hard because I have to tell some patients, no, in my opinion, you can use it to treat nausea and vomiting related to treatments or poor appetite, but to use cannabis as a treatment for cancer is something I can't recommend at this time. Many of the things people come in to seek treatment for are actually not approved of in the state of Florida. So the top players, insomnia, chronic pain, fibromyalgia, anxiety, actually those exact diagnoses are not approved of in the state of Florida. However, we have a diagnosis in the state of Florida called similar to. So if I, as the cannabis practitioner, can justify to the state of Florida that the science that I am aware of points to being able to use cannabis to treat your issue, even if it isn't one of the approved of diagnoses, I can send a letter to the state, and if the state doesn't agree with me, they will say no. And therefore, the most common things we treat, they all need letters to the state, because I've had fabulous success with arthritis. But arthritis is not at this moment an approved of diagnosis in the state of Florida, and we need to send a letter to the state. So that's a lot of things that I think we can benefit from that aren't in the list. And then there are some things on the list that I'm not really always sure why they're on the list, but when you come in, we go over the diagnoses that you have, what the state approves, and how we make them mesh if there's something that I think I can do for you there. Right. So there are theories that, the frontal lobes in particular of the brain continue to develop into your mid-20s, especially boys. And is there a danger to using cannabis before that, in that it might somehow impact the way your brain develops? It's certainly a concern. And that's why we don't treat younger patients lightly. We require 2 cannabis physicians to review their medicines and determine if they think cannabis is going to be good for them. I can tell you that most pediatric patients are on CBDs, right, the non-psychoactive portions. And we know that the approved of drug Epidiolex, which is by GW Pharma, it's used for 2 specific types of seizure disorders in pediatric patients, is great. And we know that cannabinoids that are not psychoactive help with seizure disorders. But I wouldn't add THC without working with a pediatric cannabis expert who says, yes, I believe this child needs a little bit of THC. And in pediatrics, that's really what it is. It's larger quantities of non-psychoactive cannabinoids and a very tiny amount of THC, only to get what we call the entourage effect. The entourage effect meaning the plant of cannabis has THC, which gets you high, other non-psychoactive cannabinoids, and what we call terpenes, which are the smell, flavors, and flavor portion of the plant. So for example, when you do aromatherapy with lavender during a massage, that aromatherapy is using terpenes. And therefore, we look at the THC, the non-psychoactive cannabinoids, and the terpenes to determine what's best to treat your problem. So in the pediatric patient, if we can get away with not going to the psychoactive portion, that's our goal. It's kind of our goal with a lot of patients, because most of my patients, especially the elderly ones, they don't want to get high. And so we spend a lot of effort trying to figure out that exact combination where they won't get high. Most people think of cannabis as, oh, let me smoke a joint or rip a bong or something. But the reality is medical cannabis is very different than that. Probably the most commonly used delivery systems right now are sublingual drops, and I think I have some right here. So it's a bottle, it has a dropper, you shake up the bottle and there's an oil, and you put the drops under your tongue. You hold them there for about 30 seconds and then you swallow. This is called a tincture. And the greatest part about a tincture is that you have good control because you can, down to the drop, decide how much we need. But in addition, it takes about 30 minutes to work, but will work 4 to 6 hours. So that's a nice delivery system for longer periods during the day and maybe before bedtime. Another thing that's useful is a vaporization pen. So it looks like a pen and you push a button and it creates a vapor from oil. And the great part about the vaporization pen is that it works within 5 minutes. It doesn't last as long, maybe up to 2 to 3 hours max. But if you have a moment of pain or a moment of panic or anxiety, it can be invaluable for quick onset. Oral pills or gel caps of cannabis are very useful in certain people, but they have issues. Number one, they can take anywhere from 1 to 3 hours to work. And then once they work, they can last for 8 hours. And if you're someone who's very sensitive to the THC, the psychoactive cannabinoid, it can be more powerful once it's gone down the stomach and gone through the liver. And unfortunately, we see people who use them and they get very high, uncomfortably high, and it takes a long time to wear off. I don't like to start with orals until the patient has some experience with other delivery systems that don't last as long. But for sleep, it can be great once you understand how cannabinoids work in your body. Another way we use are patches, skin patches. And what's interesting is they provide lower levels, so most people do not feel so high as they might from a sublingual or an oral or a vape, and they get a long time, like 12 hours out of a patch. So patches are very good for chronic pain in patients that don't want to be having any high and who don't need a particularly lot amount of cannabis. There are other delivery forms. People always come in and ask me about edibles, but edibles are really at this moment something that are in states with recreational or legal adult use cannabis, and they are the same thing as a pill. They're just housed in a cookie or a candy, and they can take a long time to work, and the results can be quite strong. So we don't like to use edibles either. We tell patients if you go to another state that's legal, I don't think you should run in and buy an edible, because there are many stories I hear all the time about patients who go to Colorado, get off the plane, go buy a brownie, and 3 hours later they're in an emergency room because they're having panicky feeling, rapid heart rate, dry mouth, and anxiety. And so we're always looking for delivery systems. The newest and latest and greatest that's very hopefully going to be more commonly used are suppositories. Well, nobody likes suppositories. They all remember back when their mother made them use a suppository when they were a little kid and had a fever. But we have both rectal and vaginal suppositories. And the nice part about them is they do get absorbed and they do work really nicely without having to go through the mouth to the stomach to the liver. So for instance, for pain patients, cancer patients, it's a nice option, the suppository option. Every day we come across new delivery systems, inhalers, oral films, and there are these things called concentrates for people who need much stronger amounts. And they very concentrate. They concentrate the marijuana in a very small quantity, but the dose becomes the size of a grain of rice. And for some people, that's hard to do, and then they accidentally take too much, and then they have all the negative things happen. So we only use those concentrates in experienced users. So everybody says to me, you're going to be out of a job when they make marijuana legal. And I say, no, I don't believe that at all. So if you look at Oregon, for example, patients who have their medical card go in one door of a dispensary, and those who want legal adult use go to another door. The difference is people with a medical card don't have to pay sales tax, so they save money. So there's still always going to be a role for people who want a card, but it's less about money. It's more about this. There will always be people who don't feel comfortable and want guidance. And guidance from someone with medical training, not guidance from a bud tender at the dispensary. I would say one of my biggest obstacles as a provider is I will tell a patient what to get to start, and they will go to a dispensary and the bud tender will say, oh, I know that's what got recommended, but this is really good and you should try it. And I've had patients have bad reactions because they listened to the bud tender. I think bud tenders have great experience and have a lot of insight, but the role for practitioners is for patients who are more naive and have complex medical issues, and I think there will always be a place for a good medical provider to guide them.